Dr. Smita Malhotra is the medical director of Los Angeles Unified School District. She's a mother, pediatrician, author, and speaker. Prior to joining Los Angeles Unified, Dr. Malhotra was the director of a newborn nursery and co-founder of a program to build resilience in children experiencing trauma for Los Angeles County. She's the author of the Newborn Handbook and has contributed to the Washington Post, the Huffington Post, Los Angeles Times, and other publications. Dr. Malhotra believes in healing the whole child and family by combining traditional medicine with alternative therapies and advocates for providing children, families, and staff with tools to take charge of their own health and nutrition. Hi, Dr.
Hi,
Smita.
thank you.
Smita. I can't get it right. Nice to see you.
No, you got it right. Thank you for having me.
So I want to start with Los Angeles Unified School District, LUSD. This is the second largest district in the United States with more than 500,000 students and has recently implemented the most comprehensive mental health services in the country. So can you tell us about what the district is doing to support its kids and the results you've seen so far?
Yeah, and I have to warn you ahead of time. I get really passionate about this, but like you said, LAUSD has one of the most comprehensive medical and mental health services in this country, and really, it's because LAUSD has always been invested in school-based healthcare. Both mental and physical health services at school, and it's really because of our visionary leadership that over 40 years ago invested in school-based healthcare, which includes school-based health centers and wellness centers throughout our district. So now we have school-based health centers run by our own physicians, LAUSD physicians and nurse practitioners. We have wellness centers run by healthcare partners in LA County, and we have Wellbeing centers, which offer mental health services in partnership with the LA County Department of Public Health. I'm a huge believer that healthcare and education aren't separate.
Yes.
They never were. There are always two sides of the same coin. And if we are to really make a difference in the physical and mental health care of students, we need to bring healthcare to where they spend most of their days for 13 years of their lives, which is at school. And so this is really important after the pandemic, where
Yeah.
rates of anxiety, depression, and behavioral challenges have risen significantly. And schools have now become, de facto mental health systems for many children, especially those that do not have access to outside care.
Yeah.
But with the right tools, schools can be one of the most powerful and essential places to address mental health issues and have early intervention proactively. Like I
Yeah.
said, this is where they spend most of their days, right? So LAUSD not only has 800 psychiatric social workers working throughout our district, we also have brought telemental health to our district. So now
Mhm.
any parent in our district can request mental health services for their child through their parent portal, and they can receive mental health services either at school or through the comfort of their own home through our telehealth providers. And, like when I was in private practice, I used to tell my own patients in private practice that, therapy is a luxury. First, it
Yeah.
takes a while to get into a therapist and it costs a lot of money. And here we are, providing this kind of access to our students at no cost to families. So
Mhm.
this kind of access is really unprecedented. And the results are ultimately connecting more kids to care and proactively addressing mental health issues before they become a crisis. So,
Yeah. That's amazing. How long has LAUSD been doing the mental health portion? I know you talked about a 40-year history with the other piece of it, but mental health is more recent, right?
actually, no, mental health services have been provided throughout our district for many years.
Okay.
The telehealth portion really has been in the last 2 years, I would say. Um,
Okay.
through our state, through the Child, Youth, and Behavioral Health Initiative, our governor has actually invested millions of dollars into revamping the behavioral health system. And
Okay.
one of the benefits of that is that there is a partnership with the county where there is funding for all school districts in LA County to bring telehealth services to their district.
Hmm.
So this part is relatively new,
Yeah.
but the it provides so much more access for our
Yeah.
students.
Okay, that makes sense. So I'd love to ask you about mental health education. So at Dopamine, we believe every child has a right to understand the relationship between mental health and technology because that is where we focus. So do you agree with the idea that all kids need to learn about mental health in general and why?
Yes, I mean, I strongly agree that kids need to learn about mental health. That is foundational to a child's overall development. It influences how they think, feel, behave, relate to others. And teaching children about emotions, stress, anxiety, coping strategies, it equips them with the tools to understand themselves and navigate challenges more effectively. And
Hmm.
when kids learn to like actually name their feelings and manage them in healthy ways, they build emotional intelligence, which is
Yeah.
rare these days sometimes. They build resilience, they build self awareness. And most importantly, I think introducing these concepts early helps to normalize mental health conversations. I think
Yeah.
one of the biggest things students in our district have told me is that there's so much of a stigma around mental health and
Hmm.
talking about your own wellness and emotional well being. There's this sense that, you're weak if you do. And
Yeah.
so when you normalize these conversations, we actually just this past Friday had a youth mental health symposium, which
Okay.
was run and built by our students, where students talk to each other about mental health and what the challenges they've gone through. And so I really feel like this, education fosters a culture of empathy and support at home, in schools, with peer relationships. And since we're talking about technology,
Yeah.
it's important for kids to understand the relationship between mental health and technology, especially when they're growing up in a digital age where social media, gaming, texting, constant connectivity is a part of daily life. And while these tools are really can be important in communication and creativity, a lot of students have found online support,
Sure.
but it can also contribute to anxiety, sleep disruption, attention difficulties, a distorted sense of self image, especially when the boundaries are not clear. So it's so important to teach kids how to use technology intentionally. You know, especially with comparison on social media and the importance of unplugging in a world that increasingly blurs the line between what's digital and what's real.
Yeah. That actually leads me to the next thing I was going to ask you about, because a lot of the things you talked about were some of the reasons for why LUSD went phone free pretty recently. So I'd love to pivot to that. But first, I'm going to give you a couple statistics, which you probably know already. But 77% of US schools don't allow smartphones in schools, yet 97% of adolescents use their phones during school hours for an average of 43 minutes. Social media is taking the highest proportion of time. So LAUSD went phone free just this year, announced last year, implemented this year, to address concerns about some of the things you were talking about already. So, student mental health, academic performance, safety. So, I'd love for you to tell me how it's going so far. And what would you say to other districts and independent schools that haven't taken the step yet?
Maybe I'll start with the second part first. I would say that the research behind this is quite compelling. I
Yeah.
mean, most other countries also don't allow phones in their schools.
Yeah.
But what the research has shown is that policies that limit smartphone use during the school day increase performance on both standardized test scores and end of course exams.
Yep.
And this is equivalent to an additional hour of instructional time per week. And also, limiting smartphones reduces the number of mental health visits for
Yeah.
children by
Mm-hmm.
about 2 to 3 visits per child per year. So, so there's tremendous research behind this that tells us that this is a helpful and positive thing for children. But when we implemented this in LAUSD, the goal was for this policy to help create a healthier learning environment for children and foster more meaningful in-person interactions that nurture their social and emotional development. So overall, it's been going well. We just implemented this in February.
Yeah.
A lot of our schools had already implemented this before, and LAUSD has had a general policy about this, but now it has been solidified into a district-wide policy and a more universal policy. And this actually helps our teachers and administrators, takes the burden off of them,
Yeah.
like not to be the phone police.
Yeah.
And we've given schools the choice. So you can use pouches, you can use the honor code, whatever works best for your school and your community. And so, since it was just implemented, the results are still to be seen, but it's
Sure.
been very well received. And one thing I want to note is that, you cannot enforce a policy such as this without also providing the mental health supports that kids need.
Yeah.
Now you've had kids that have had access to their phone during the school day, and now you're kind of limiting that access. So they're going to need some mental health supports. And so we also provided tools for dealing with limited access to phones. We want also bringing out our LAUSD digital wellness plan, where we want all students to have a wellness plan that they go through with our psychiatric social workers that identify their trusted adults in their school, what coping strategies they use, giving them tools, really focusing on preventive services in schools before they progress to treatment. And finally, this is also an opportunity for us to provide education on how to be a good digital citizen.
Hmm.
Social media is not going to go away. Technology is not going to go away. Eventually, our students are going to go into the real world where there are no policies around phones and media use.
Yeah.
So it's important for students to learn healthy habits around technology and social media that will benefit them when they become adults. And I think it's just incredibly important to have that healthy relationship with technology when they go out into a world without policies that restrict their phone use.
Yeah, that is so true. I mean, you talked about, you can't just have a policy without supporting it, right? And you talked about mental health. For me, you also talked about education. To me, that is so key, because when kids realize it's not a punishment and parents realize it's not a punishment, and here's all the amazing reasons why, and here's all the research we have. You mentioned a couple of statistics already. It's really hard for everybody to not understand, the reason behind it, but you do have to teach people why. And one of the biggest things, and this is my next question actually, is the fear of emergencies. So on the parent side, and I know you're nodding already, you know what I'm going to get to here, but the parents are actually usually the ones that are pushing back on those phone-free policies. I went to one meeting before LAUSD announced it was in my local area, and there were some very angry parents there. And I think likely it was because they knew the topic of it and they were already angry about this. So I think it was probably not a good cross section of reality. But the reason they push back is what they call emergencies. So, but security experts actually all agree that they're not helpful in a true emergency. They're loud, they're distracting, they breed misinformation. And I had to look this up myself for my parent ed, but the odds of death from a school shooting, and I'm sorry we have to talk about this, but we do because that's what these parents are thinking about. It's actually 1 in 5 million. Depression is 1 in 4, anxiety is 1 in 5. You're more likely to die in a plane crash or get eaten by a shark. Okay. And it's really hard to put these numbers on it because it's parental anxiety, which we can all understand. But I know I just threw a lot at you, but what would you say to the parents then that are pushing back on the idea of phone-free schools?
I'm a parent too, so I
Yeah.
completely get it. And it's
Yeah.
completely understandable that parents want to feel connected to their children during the school day, especially in a world where constant communication has become the norm. I mean, when I was younger, I still can't believe, like, my mom sent me to school and no, had no contact, no way to contact me. She just trusted the school would take care of me. Or, when I went out, I was not in constant contact with my parents. And now it's different. We have that luxury to track our kids wherever they are, have constant contact. But it's important to understand that phone-free policies are not about cutting off contact. They're about creating a focused and safe and developmentally healthy learning environment. So, research consistently shows that phones in classrooms are a significant distraction, not only for the student using them, but for others who are around them as well. And when students are free from the constant, pull of social media notifications, they're more present, engaged, and able to build real life social skills. I mean, we expect our students who are in extracurriculars and sports not to be using their phones. So why not, in a school setting where they're learning
Yeah.
with academics? From a safety standpoint, I think it's important to know that in a true emergency, schools have protocols that are
Yeah.
designed to keep students safe and communicate with families in an organized way. And
Hmm.
like you said, security experts, especially those who train schools in crisis response, agree that phones can actually create more chaos in
Yeah.
emergencies. You may have 300 parents showing up to a school, or
Yeah.
what if this is hard to talk about, but what if there is a school shooter and you have to be quiet and a phone goes off,
No, I know. Yeah.
and then students also start receiving misinformation that can
Yep.
compromise safety procedures or become distracted when immediate action is required. So in these moments, school staff need to focus on protecting students, not competing with a flood of messages or calls, or having children, please turn off your phones, don't let them go off right now. So there's also, ways so that's that one emergency, that big emergency. But
Yeah.
for individual student emergencies, we also have ways for kids to access their phones if any one of them are having emergencies. So teachers are instructed to allow kids to have access to call parents. So we aren't entirely cutting off their access to phones in an emergency for them.
Yeah.
So I think that's important to remember. And finally, phone-free schools are about trust and boundaries. So just as
Hmm.
we, like I said, expect kids to participate without distraction in other environments, the same applies at school.
Yeah.
And teaching kids to manage their time without a device constantly in hand is a skill that serves them for life.
Yeah. I mean, you talked about trust and boundaries. I would actually add freedom to that because when we've worked with Yonder, I've interviewed the CEO. I know that's like one of the solutions you guys use, but that's one of the biggest pieces of feedback that they get. Because like I said earlier, it's not a punishment. What it does actually is gives kids the freedom to be kids and not have to maintain their online lives, which is exhausting, and then obviously trying to learn on top of that I can't imagine. It must be,
So glad I didn't have
I
this
know.
when I was a kid. Like I would be so stressed out.
It must be
Um,
impossible. Yeah.
yes.
So it's really just usually the parents push back, the kids push back, but they grow to really like and appreciate it. Lunchrooms are noisy again. They're doing all that great social emotional learning that we've been talking about. Obviously, we know the increase in academics. I mean, that's really widely documented in test scores and things like that. So yeah, I think there's probably a little bit of anxiety at first from parents and the kids. I think administrators and teachers are probably fully on board.
Yeah.
But I think once they get into it, and that's why I asked you how it's going, I know it's very soon. That's generally the feedback is just this kind of relief and the freedom. So I think that's big. Okay. So I wanted to ask you about, I want to kind of pivot to mindfulness, which is kind of a big part of your philosophy, even as a physician, and in your work in LUSD as well. So according to the Surgeon General's 2023 advisory on social media and youth mental health, depression and anxiety in kids has reached its highest point in history. And it's doubled during the pandemic. So 25% of youth experience depression, 20% experience anxiety. So, this is a broader question, but how can families practice mindfulness to improve mental and physical health?
Yeah, I love talking about this. So, mindfulness is a practice of paying full attention to the present moment without curiosity and without judgment. So, families can integrate very simple practices into their daily routines. One of them is breathing exercises, for example, box breathing, where you inhale for 4 counts, you hold for 4, and then you exhale for 4 and hold for 4. So, that for me, I've used it when I was in private practice. I used to do it before every patient visit, before we even started the visit, and it just changed the whole direction of the visit. Because it's instantly you all are calm, and it is just such an easy way to calm the nervous system, and it's easy enough for children to learn. So practice this together before school, bedtime, during moments of stress, before tests. You can teach, both this to both kids and adults, and really is a great tool to self-regulate emotions. The other mindfulness activities are, like body scans, where each person lies down or sits quietly and mentally checks in with different parts of their body. You notice sensations without trying to change them. And then one of my favorite mindfulness activities, mindful eating.
Mm.
So really it's important for families to sit, if they can, I know families have so many things going on, but if they can, sit together while eating meals and take a few minutes during meals to slow down, notice the texture of the food, express gratitude. And one of my most favorite ways of practicing mindfulness, which is what I do with my kids, are nature walks. And it doesn't, you don't have to be living in a forest to do a nature walk. You can live in LA, in a city, but just taking walks with your kids, in a safe area, obviously, in your neighborhood, naming things you see, hear, or smell, and that helps train your attention to the present moment, and grounds everyone in the present moment. And then finally, journaling, gratitude sharing, great way to end the day. So, every you can have your family, write down or talk about one thing they noticed or felt thankful for. And over time, all of these things, they improve sleep, they enhance your emotional regulation, they even boost your immune function. And so these moments of reflection and feeling calm will guaranteed help your children develop lifelong coping skills and a more calmer home environment.
Yeah, I mean, to your point, there all are no boundaries between physical and mental health.
Yes.
They feed each other, right? So I think those strategies make a lot of sense, and we have a lot of research that supports that they work and that they do boost your physical health. If you practice very simple techniques like the ones I think anybody can implement. Some of the things that you've talked about, they really, really do work, and they move the needle physically, right? Which is, I think, why you are passionate about bringing those two things together. So it
Yes.
makes a lot of sense. Okay, so I want to push on children's health just a little bit more. So this is from a 2023 poll. It was the Mott National Poll on Children's Health. So, mental health and modern screen technology dominated the top 6 positions for parental concerns. So, they surpassed traditional health concerns like diet, for example. We talked about that a little bit, smoking, vaping, and even gun violence. So, are parents right to worry about these issues, modern screen tech and mental health?
Yes, parents are absolutely right to be concerned. I mean, this poll actually highlights what many of us in pediatrics and education have already suspected, that mental health and screen technology have become the leading course concerns for families,
Yeah.
surpassing diet and substance abuse. And we found a profound shift in how children spend their time, interact with others, regulate their emotions, all of which are affected by how they use technology. Screens are no longer just entertainment. They're shaping how children develop socially, emotionally, neurologically.
Yeah.
To throw some more statistics here, according to the U.S. National Survey on Drug Use and Health, anxiety for those born after 1995 increased by 139% from 2010 to 2020, coinciding with the rise in smartphones and
Yeah.
social media. I mean, that's huge.
Yeah.
And then Common Sense Media has said half of all teens report feeling addicted to their phones, and
Yeah.
97% of 11 to 17-year-olds use their phones during the school day.
Mm-hmm.
And what we've seen is that frequent social media use can actually alter brain development for children
Yep.
in terms of impulse control, emotional regulation. And so, because children with social media, they're creating this environment where children are constantly comparing themselves to these curated images, right? And receiving these dopamine hits, feedback in forms of likes and comments, and sometimes also experiencing bullying, online
Yeah.
bullying and exclusion. And these interactions can be so harmful, especially during key developmental windows when children are forming their sense of identity and self worth.
Mm-hmm.
So, you know, th- while I say all of this, I now want to say that technology in itself is not the enemy, right?
No.
Like I said, social media is not going away. All of the screens are not going away, but when used thoughtfully with age appropriate boundaries and active parental involvement, educational intent, technology can enhance learning and creativity. So
Sure.
the real concern really is when screen use becomes a substitute for connection, movement, emotional regulation. And as pediatricians, I think the American Academy of Pediatrics will tell you we need to guide families towards a balanced approach. So, promoting digital literacy, encouraging media free times like at meals or bedtimes, and helping kids develop healthy coping skills, both in their online and offline lives.
Yeah. There was so much that you said there, and it was all correct. I think the biggest thing you said is, for me, is when you talked about the boundaries, right? Because you're right, it's not going anywhere. And we talk about this too, that technology is not bad. I think what's happened is, and we say this too, technology, when technology's in charge of you, right, and not the other way around, that's what we would call an unhealthy relationship with technology. And I think that's what we're seeing a lot of, and it makes sense. I mean, these kids have developing minds. You talked about a lot of the dopamine elevation and everything else, like, and parents can help themselves either. I mean, we have to work to have a healthy relationship with technology, but I think as parents, like, one of the easiest tips we can do is to put in some boundaries to help our kids, because they're not going to necessarily be able to regulate on their own. I mean, yes, we can give them awareness, education, everything else. But like you said, it's here to stay. So if we can put in boundaries that'll help guide them, I think that's probably the number one thing we can do as parents and educators and everybody else. So yeah, I'm really glad that you brought that up. So I think that's spot on. Okay, so last thing I want to ask you about is, I know that you led LUSD's transition away from distance learning. That was right about the time you came on board. We have plenty of research now that covers how the pandemic affected kids' mental health. So, can you elaborate on how you saw technology affecting mental health during and after the pandemic?
Yeah, for sure. So much PTSD there for
I
everyone.
know.
During the pandemic, screen technology became an essential bridge for learning,
Yeah.
connection, even entertainment, as we can all attest. But
Yeah.
as schools shut down and shifted to remote learning, we saw a surge in screen exposure that was unprecedented in both duration and intensity. And many students in LAUSD were spending 6 to 8 hours a day in front of a screen just for school. And that didn't
Yeah.
include the additional hours spent on, phones, video games, social media.
Hmm.
And while it all allowed for continuity in education, the toll on children's mental and emotional health, became very evident when we came back. So we began noticing, significant increases in attention problems, mood disorders, physical complaints, headaches, eye strain, sleep disruption. Younger children struggled with engagement,
Yeah.
lost opportunities to develop social skills, For older students, the isolation with the loss, the constant digital interaction led to rising rates of anxiety, depression, disconnection from their peers. So while technology was helpful in the short term, it couldn't replicate the full emotional and developmental needs of a school environment. So in many cases, the longer students remain physically disconnected from their peers, the harder it became to reintegrate. So after the return to in-person learning, we didn't just see academic gaps. We saw social and emotional ones too.
Yeah.
And so this whole experience uh, just reinforced the importance of creating school environments where students have opportunities to connect, move, collaborate, and be seen by others in real life.
Yeah.
Um, and it also reminded us that screen time has to be carefully balanced with real world interaction, and that schools and parents and educators and healthcare providers need to work hand in hand, to build a healthy and balanced rhythm for our children.
Yeah. I mean, everything you said, so spot on. It was a necessary thing. Like, how great was it that kids could still learn? How great was it that you could connect with your grandma, that you couldn't see in person? But what we saw, and I don't know if you have any data on this, for me, I'm a social media marketer, so I'm kind of under the hood and behind the scenes and kind of seeing the trends and what's happening. So we saw everything go up exponentially, video views, website visits, like every metric you can think of. And it made sense, right? Because people were at home, they had a lot of time, maybe they were doom scrolling, right? A little bit, stuff like that. But at least on my end, from being under the hood, it didn't go back. Right. So we kind of stayed at this level of probably unhealthy amount of tech use. Right. So at least from behind the scenes. And if you zoom out and look at the statistics in general, we haven't kind of come back down. Right.
Mm.
So it's interesting. I mean, the pandemic is definitely way in our past, but if you look at all the charts and the data, we're still kind of on an upward trajectory. So it's super tricky. It feels like trying to turn a cruise ship around or something. But yeah, I just wanted to throw that in there that yes, we all had to do it. We needed to do it, but we're not in a pandemic anymore, right? And so how do we kind of maybe get a grip again, on this and prioritize some of the things that you talked about, right? Movement, in person, things like that. And I know just from a societal level, we're going in that direction, but I don't know. I'd love to see the data kind of catch up with that. So I don't know if you had anything else to add to
Yeah,
that
I mean,
piece.
how I look at it, in terms of children's mental health, before the pandemic, children's mental health was not ideal.
No.
There was a lot of work to be done. And after the pandemic, we often talk about recovery.
Yeah.
But recovery means going back to what we had before. So I feel like this is an opportunity for renewal, where we
Yeah.
create a new way, a new
Right.
system. We recreate the structure. And maybe it was a wake up call for all of us
Yeah.
that we have to live in our real lives, and whatever you see online is not always real.
Mm-hmm.
And just really teaching our kids to connect with themselves in a way that always keeps them grounded in what is real and what is digital. Um,
Yeah.
yeah.
And to your point, this has been going on for a while. Gen Z, which you mentioned the statistic of people born after 1995, I think. Gen Z is the most anxious generation. I mean, Jonathan Haidt's whole
Yes.
book is about this, right? And
Mhm.
these were kids that were coming of age well before the pandemic. So yes, this was already on a decline. The pandemic, if you look at the numbers, did accelerate it a bit. But I agree with you. I think I'm optimistic as well that it was maybe a wake up call. And I'm definitely seeing parents of younger kids being much more aware of this issue. I mean, Gen Z parents, they didn't know, it was all techno optimism. This is all great. Let's go all in. There's no controls, everything else. But I do think you're right. And I do think calling it, what did you call it?
Renewal,
A renewal. I
Yes,
like
a
that
renewal.
better.
We're creating
Yeah.
something new going forward now.
Yeah. So I think in a way, maybe you're right. Maybe it did reveal this thing that was under the surface anyway, and sort of needed to come out. So yeah, we can end it on that optimistic note. Thank you so much for your time today, for everything you're doing. I love your approach. I've always been a big mental, physical health coming together person, just from like a personal philosophy. And thanks for all you're doing on the mental health front. It is so important. And LAUSD being the second largest district, providing leadership on that, I think is so critical. I think hopefully other smaller districts and independent schools and everybody else will follow. So
Yeah,
thank
thank
you.
you for having me. This
I
was
really
wonderful.
appreciate it.